Cerebellar hemisphere and cerebellar vermis syndromes, clinical deficits. Introduction. The cerebellum, a crucial component of the brain, is involved in motor control, coordination, and various cognitive functions. This complex structure consists of two primary subdivisions, the cerebellar hemispheres and the cerebellar vermis. Syndromes affecting these distinct regions lead to distinct clinical deficits. This video aims to contrast the clinical manifestations between cerebellar hemisphere syndromes and cerebellar vermis syndromes, shedding light on their anatomical and functional differences. Anatomy of the cerebellum. Before delving into the clinical deficits, it is essential to understand the anatomical distinctions between the cerebellar hemispheres and vermis. The cerebellar hemispheres, lateral to the midline, contribute to motor planning and execution. In contrast, the cerebellar vermis, located at the midline, is primarily associated with axial and proximal limb control and plays a crucial role in maintaining posture and balance. Clinical deficits in cerebellar hemisphere syndromes, ataxia and dysmetria. Clinical deficits in cerebellar hemisphere syndromes, cerebellar hemispheres govern fine motor coordination and precision. Lesions in this region often result in ataxia, characterized by uncoordinated and unsteady movements. Dysmetria, an inability to accurately gauge the range of movement, is a common manifestation. Intention tremor. Intention tremor, a tremor that exacerbates during purposeful movements, is frequently observed in cerebellar hemisphere syndromes. This tremor reflects the cerebellum's role in refining and modulating motor commands. Dysdiadochokinesia. The inability to perform rapid alternating movements, known as dysdiadochokinesia, is another hallmark of cerebellar hemisphere dysfunction. This deficit underscores the cerebellum's role in coordinating complex motor sequences. Hypotonia. Cerebellar hemisphere lesions may lead to decreased muscle tone, or hypotonia, contributing to a sense of limb heaviness and weakness. Clinical deficits in cerebellar vermis syndromes. Truncal ataxia. Cerebellar vermis syndromes are prominently associated with truncal ataxia, affecting the coordination of axial and proximal limb muscles. Patients exhibit instability in maintaining an upright posture. Nystagmus and ocular motor deficits. Cerebellar vermis lesions can result in ocular motor disturbances, including nystagmus. These eye movement abnormalities indicate the cerebellum's influence on gaze stability and coordination. Autonomic dysfunction. Dysfunction of the cerebellar vermis has been linked to autonomic disturbances, such as alterations in heart rate and blood pressure regulation. These autonomic deficits contribute to the broader clinical picture. Emotional and cognitive changes. Some cerebellar vermis syndromes are associated with emotional and cognitive changes. Patients may experience mood disorders, cognitive impairments, and alterations in affect regulation, reflecting the cerebellum's involvement in non-motor functions. Conclusion. In conclusion, understanding the distinct clinical deficits between cerebellar hemisphere syndromes and cerebellar vermis syndromes provides valuable insights into the cerebellum's multifaceted role in motor and non-motor functions. While cerebellar hemispheres govern fine motor coordination, precision, and motor planning, the cerebellar vermis is crucial for axial and proximal limb control, posture, and autonomic regulation. Clinically, these differences manifest in a range of motor and non-motor symptoms, emphasizing the intricate nature of cerebellar function and the nuanced consequences of cerebellar lesions.